If you're looking for resources for veteran addiction, you're not alone, and quality treatment is available. Addiction is a relatively common problem among veterans. According to national data, around 24% of U.S. veterans have or are at risk of a substance use disorder. Many veterans develop problems related to substance misuse after using drugs or alcohol to cope with the challenges of military life. If you're having difficulty accepting the need to seek addiction treatment, it can be helpful to reframe how you think about strength. Addiction is a critical health problem, just like any other medical condition. Reaching out for professional help is a sign of strength. Recent research on veterans has found that veterans with PTSD have a stigmatized perception of seeking treatment, which leads many of them to drink as a coping mechanism, increasing their risk of alcohol-related problems. Veterans may choose to fight these afflictions alone rather than reach out for help, which can worsen mental health concerns and addiction. Your experiences in service have likely provided you with the resilience you need to tackle your addiction. Set aside the belief that seeking help means you are somehow weak. Admitting you need help to recover shows you can acknowledge and face your addiction head-on. If you're worried about stigma, there are things you can do to overcome it. First, educate your loved ones about addiction. Addiction is a legitimate medical condition that can improve with help. Talk about addiction treatment as a part of routine healthcare. Many primary care doctors incorporate addiction treatment into comprehensive healthcare plans. Consider providing only general information about treatment if you're worried loved ones will not be accepting. Perhaps you can tell them you're getting treatment for a health problem related to your time in the service. You don't have to provide personal details to those not supportive of your decision. Realize that you're probably being much harder on yourself than your peers. Try to ignore negative opinions and misinformation. These beliefs will not help you during recovery, so it's best to ignore them. Build a support network. Support is critical as you carry out your mission to recover from addiction. It's important to surround yourself with fellow veterans, friends, and family who support your choice to seek treatment. Contacting the VA can also link you to invaluable support. They have many services and resources intended to support veterans with addiction symptoms. Once you've realized your strength and can look past stigma, it's time to consider a treatment program. Many veterans begin their recovery in an inpatient treatment program, which provides structure and removes everyday triggers and stressors. In an addiction treatment program, you'll have access to services such as therapy, group counseling, and medication to help you overcome your addiction. After inpatient treatment, many choose to move into an outpatient program, where they continue to attend therapy and group sessions within the community while living at home. At the Recovery Village, we offer services specifically designed to meet the needs of veterans and first responders. Our centers are private, physician-led, and proud members of the VA Community Care Network. Our clinicians are trained in trauma-informed care, military culture, and treating veteran-specific addiction and mental health needs. We also offer co-occurring disorder treatment to address mental health conditions like depression, anxiety, and PTSD that can occur alongside addiction. If you or a veteran loved one are struggling with addiction or mental health, call us today at 855-905-5637 to speak to a veteran advocate. It's time to get your life back.